Welcome! If you're gearing up for your community medicine exams, then you have come to the exact right place. We're about to break down the National Program for Prevention and Control of Non-Communicable Diseases into a super clear, high-yield guide designed to help you absolutely ace your exams.
Okay, let's kick things off with a single, most important number you need to frame your entire answer. In India, non-communicable diseases, or NCDs, account for a staggering 63% of all deaths. Now, that's not just a statistic, you guys. That is the entire reason this program is such a massive public health priority.
You know, to really nail a 20-mark question, it is all about the structure. So here's our blueprint for today. We're going to walk through the NZD challenge, the organizational structure, the core strategies, the people who make it happen, and how it's all tracked, and then we'll wrap it up with a quick-fire exam recap.
All right, first up, let's set the scene. We need to establish the why behind this whole thing. This section gives you the perfect introduction for your long answer, explaining the problem and the program's core mission.
Here's the official definition you'll want to know by heart. But the key thing to pull out here, the big takeaway, is that it's all about integration. See how it's implemented under the National Health Mission? And it covers the whole spectrum, from promoting healthy habits and screening, all the way to diagnosis and long-term management.
So these are the 6 pillars, the main goals that drive the entire program. And you can see, right? It's not a one-trick pony. It's not just about screening people. It's also about promoting health in the community, training healthcare providers so they're ready, and making sure the supply chain for meds is rock solid. Listing these out shows you get the full picture.
All right, now for a part that's going to score you some serious points, the organizational structure. This shows you understand how a policy on paper actually turns into action on the ground.
This is the perfect way to draw it out in your exam. It's a super clear visual that shows the flow of command. You can see how everything trickles down from the national NCD division to the state, to the district, and right down to the CHCs, PHCs, and subcenters where the real work happens. This tiered structure is absolutely crucial.
Okay, so we've covered the why. Now the examiner wants to know how it all works. This part is the real heart of your answer, where you detail the specific actions and strategies that the program uses every single day.
Think of this slide as the engine room of the whole operation. These 8 strategies are what make NPNCD actually work. It starts with prevention, promoting healthy lifestyles. Then it moves to screening for early detection. And once someone's identified, there are standard treatment plans, a solid drug supply, and a great information system to track everything. It's a complete package.
Now, listen up. If there is one strategy you absolutely have to highlight, it's this one, population-based screening, or PBS. This is where the program gets proactive. It's not sitting around waiting for sick people to show up. No, it's going out into the community, where frontline workers use a special tool, the Community-Based Assessment Checklist, or CBAC, to find people at risk early.
You know, a program like this is just a bunch of ideas on paper without the people who make it happen on the ground. So let's talk about the human resources framework. This shows the examiner you understand the real-world nuts and bolts of public health. This table, you're going to want to replicate something just like this in your answer. It's a brilliant way to show how the work is shared at the community level. You've got the ASAO worker starting things off with that CBAC checklist, then the community health officer steps in for screening and meds, and finally, the A&M and multipurpose worker help with referrals and follow-up. It's a real team effort.
All right, to really bring your answer home and show you get the big picture, we've got to talk about how the whole thing is tracked, paid for, and connected to other programs. This demonstrates a deep systemic understanding. When it comes to monitoring, there's one name you need to remember, the National NCD Portal. And look, it's not just some website. This thing is the digital backbone of the entire program. It's how data gets collected in real time, analyzed, and used to provide feedback to make sure everything stays on track.
So how does the money work? Well, it's a classic partnership under the National Health Mission. The central government provides the funds, but it's the states that are really in the driver's seat. They create their own specific plan, called a PIP, and they're the ones responsible for using the money effectively and reporting back. And this is a really smart point to make in your exam. It shows you understand that this program isn't just floating out there on its own. It's woven into the very fabric of India's public health system, with direct links to other huge initiatives like tobacco control, mental health, and care for the elderly. Okay, let's pull it all together. Think of this as your final checklist, the high-yield summary to make sure you're ready to score those full marks.
So here it is. This is the kind of classic 20-mark question you can probably expect to see. And honestly, after what we've just covered, you are more than ready to break this down and answer every single part with total confidence. And here you go. These are the golden keywords, the ones you need to highlight, underline, and make sure the examiner sees. When they spot terms like population-based screening, PBS, CBAC, and National NCD Portal, they'll know right away that you've got this down cold. Okay, let's pivot for a second and talk Viva Prep. A super common question you'll get is about the role of the ASHA worker. They're truly the foot soldiers of this program.
And here's how you answer it: short, sweet, and to the point. You say, ASHA's primary role is population-based screening using the Community-Based Assessment Checklist, or CBAC. They're also vital for health promotion and making sure patients follow up. Concise, accurate, and impressive.
At the end of the day, what's the big idea here? It's really about a fundamental shift in philosophy. It's about empowerment. It's got moving away from just reactive care and truly putting health back into the hands of individuals and their communities. So we've given you the blueprint for success in your exam, but I want to leave you with one final thought to chew on. This program is more than just a response to today's NCD crisis. It's a powerful public health framework. So the real question is, how can this same structure be adapted to face the new challenges of tomorrow? Think about that.